Hello everybody, and thank you very much for joining this Cityforum 2020 policing podcast. This is one of a series of events arranged for this summer, and they could not be more timely or more relevant. I'm David Shaw, and very proud and happy to be an associate of Cityforum, and have great pleasure to be moderating today's discussion, which is entitled Changing Leadership Requirements in Uncertain Times, What Has COVID-19 Taught Us? Now, Cityforum never fails to get the very best contributors to bring these events to life and make them so insightful and thought-provoking. And I'm delighted to introduce three distinguished leaders from a range of diverse disciplines today. We have Matt Jukes, the Chief Constable of South Wales Police, who's also played a leading role in the police service response to the COVID crisis. We have Jude Diggins, who is the Deputy Director of Nursing Policy and Practice at the Royal College of Nursing. And finally, we have Stefan, who's visiting professor at the City University Business School and who's also the former director of the High Pay Centre. Okay, so we're now into our fourth month of this crisis, sometimes fifth month, sometimes it feels a lot longer, sometimes it seems to have happened in a very short time, which has left none of us, whether families, individuals or organisations, left none of us untouched. And I sense that we're only now really starting to catch our breath and ask what this means for leaders and how we as individuals and organisations need to adapt to a changed world. And before we sort of open up for discussion, I'm just going to start with opening reflections from Matt, Jude and Stefan. So Matt, over to you, please.
Thanks very much, David. I mean, I think the first thing to say is, this has been overused word, unprecedented, and came at a time when, for policing, we were already experiencing a set of tremendous pressures. We've locally begun to make some real progress in relation to serious violence, but that's been all around us for the last period. And just before the pandemic struck and the escalation in March, we'd been dealing with major flooding and other things which were perhaps more business as usual, Six Nations rugby tournaments and so on. So we certainly weren't sitting waiting for a new challenge. But as that new challenge came towards us, I think the one thing I'd have to start and finish with is my incredible recognition of the quality and the compassion of the way that our people have responded. And when I say our people, obviously I mean policing, but I do think public services working together in partnership have done a remarkable job for communities, I'm sure around the world, but definitely the length and breadth of the UK have done an amazing job. And when we reflect on, and I think the invitation is to reflect on some questions around leadership and resilience, decision making and innovation, I think for policing, one of the things which is unique, despite our ability to deal with those other challenges, is the way that this has been such a universal experience for everybody, every community, every family, every household, every service, and has taken us from a policing perspective into parts of people's lives which we would never ordinarily touch. Normally people would go about their lives really with unfettered freedom in terms of how they go outside, how they shop, how they associate with their families, use public transport, and all of those things have become part of the public discourse and part of the necessary controls to deal with the pandemic. So that has taken policing into a very different space. And I felt a real responsibility during that period and a real privilege. I think the responsibilities have been threefold, really, effectively, to keep the public safe, to keep our people safe, and to safeguard the legitimacy of the way that we do both of those things. Because as we've gone into that extraordinary space, I think we were granted what could have been seen as draconian powers. And I don't think any of us joined the service to really be patrolling the streets for that second dog walk of the day or to check on what people were going to the shops for. We all join the service for that first and principal goal, which is to keep people safe. And so I'm sure in the course of the podcast you want to talk about what's changed, but my first reflection really on leadership is just how important two things have been. The first is to have clear purpose, and really clear purpose around keeping people safe has absolutely kept us locked onto a second core focus for us, which has been consistency in our values and approach. So the model of British policing, the model of policing by consent, is so precious, requires a trust and confidence of the public so much that, as we entered this period, the last thing in the world we would have wanted to do is to lose that sense of engagement and inclusion and legitimacy. Locally for us, that's meant a couple of key themes: listening and responding to our communities, and listening and responding to our people. And I could say more about that. But in essence, I suppose the acid test is what the public make of how we've managed that balance. And we've taken 15,000 calls around COVID since the end of March. That's about 1,100 calls a week. And we've taken, in those 1,100 calls a week, about 7 complaints every week about the way those calls have been handled. So I think that the message from the public in the broadest sense is that we have struck a very responsible, very humane, very compassionate balance. And that's called on people at the front line of the service to be incredibly compassionate, pragmatic, dynamic, humane. And in truth, we couldn't have invented that on March the 23rd. That had to be the way we were doing our business. So I think we've talked here about dealing with the unusual in the usual way. So I think listening to our communities, listening to our people is the way we do our work. I think the second reflection around resilience is that's obviously been a question for organisations and individuals. We have, of course, thought about what we're very proud of during this last period and what we would reflect on and change. And one thing I think we can genuinely be proud of is that we have trained and prepared for civil contingencies and emergencies as a group of partners. Jude, obviously, working with the NHS, a key partner for us during this period, but local authorities, fire and rescue services, and a host of others. And one thing I've learned about our resilience is sometimes we can look past the important infrastructure in that resilience. So our business continuity managers, our health and safety teams, these are really Cinderella functions in most organisations. They very seldom get the kind of moments of being heroes, but I can tell you they have been heroes of the last 16 weeks or so. They have been absolutely key contributors, but more than that, I think the whole organisation has recognised how important that their work has been in making us resilient in a way which is planned and prepared. Of course, the obvious second aspect of resilience is the personal aspect, and that's been an enormous question, of course, for all of us in our lives privately. But from an organisational perspective, I was really struck when a colleague described the fact that we're all in the same storm but in different boats. And the fact that we've all experienced the pandemic and the lockdown in our different ways. And from the perspective of our different attributes, our different strengths, the resilience in our family and personal lives and in our personal circumstances, but also the vulnerabilities in our personal lives, in our health. And this has really, I think, shone a light on the complexity of an organisation of thousands of people, the caring responsibilities, the underlying health conditions. And I think we were an organisation that was already very alert to those questions, but I have learned so much more about our people and how we can respond really dynamically to meet those needs. So actually our core sickness level, people not being at work because they're sick, is lower now than it has almost ever been. And on top of that, of course, we've got some people who are shielding and working from home, but actually their contribution to work is still really significant. And so alongside the resilience of individuals, and we've addressed that through a real investment in well-being and great work with our trade unions and staff associations, alongside the resilience of our people as individuals, what's been really critical is the cohesion of the organisation. The fact that some people going forward to attend COVID-related sudden deaths in people's homes, in our communities, can only do that because of the great work done in the background by people who are, some of them now working from home. So we've worked really hard to maintain an ethos of one team. And that has at times been stressed by the different circumstances people are working in, but it has been incredibly important to us. So having touched a bit on leadership and resilience, I suppose the other thing that this period has demanded is decision making in sometimes very uncertain periods. And I'm not a great one for literary quotes, but I was reminded of Theodore Roosevelt's comment that in a moment of decision, the best thing you can do is the right thing, and the next best thing you can do is the wrong thing, and the worst thing you can do is nothing. And we've been really called upon to make some very dynamic decisions on the street. Frontline colleagues have had to make decisions about how they're dealing with gatherings of people, concern from the public, those tragic incidents of sudden and unexpected deaths in the community. But also organisationally, we've had to make decisions very quickly and endeavour to do the right thing firstly, but recognise that sometimes the best thing to do was to be decisive and act. And so in partnership, that's been incredibly important and has really required a single version of the truth. So having a common understanding about data and advice has been incredibly important during this period and has allowed us necessarily to make some risk-based decisions, because the information has always been partial. It probably always is in many of the crises we deal with. But acutely here, we were dealing with issues which were not well understood internationally. So there was no chance that we could have a full understanding locally, and really being candid about what we knew and didn't know, and having a settled understanding about the information we were making decisions on with partners has been key. And then I suppose I ought to just say something about the way we've made our decisions, because, we have again looked to do the unusual in the usual way. And our command structures, including our partnership command structures through strategic coordination, have really served us well. And they absolutely demand delegation and empowerment, and for people to have freedom to operate and innovate at a whole host of levels. And I think more than ever, this period has required people to be closest to the work, to have the greatest freedom to operate that felt responsible. And I quoted Teddy Roosevelt, so let me quote George Michael, another great thinker of the 20th century. I think you've got to have faith sometimes. I think you have to have faith that you've ploughed your effort into planning, you've ploughed your effort into developing people, you've ploughed your effort into nurturing partnerships, and you cannot invent that in the midst of a crisis. We have had to have faith in all that we've done, and of course lots of check and challenge along the way at different points. But I do think that clear sense of purpose, and then a strong sense of enabling people to use their freedoms has been important. And I think the final thing I was just going to touch on was the question of innovation, and I'm sure we'll say more about this, but we have done things quickly, which we would have laboured and found incredibly complex. And so, whether it's the application of new technology or briefing out new regulation and law, new operational practice, all of that has moved at a pace which we're bound to reflect on and think, why have some of these things taken us so long in the past, and what could we roll forward from this experience so that we can make those risk-based decisions and innovate. And I do think, we should be kind to ourselves at one level. Having a fairly singular purpose has helped that. And actually, we have probably paid less attention to questions like the long-term sustainability of some of those things we've put in place than we would normally. And we'll have to double down on that question now. And you couldn't run an organisation for the long term the way we've run organisations for the last 4 or 5 months. Not least of which that has asked so much of people, and we need to be sustainable. So I think, to finish where I started, one thing which we've not let go of is the recognition of our people. So as busy as we've been, as much focus as has been for me personally on external partnerships with the devolved administration and the UK government and a range of partners here, I think it's been incredibly important for us to recognise and where we can reward the contribution of our people, because they have stepped up again to an enormous challenge, and they've done that whether they're colleagues in health and safety, ICT teams, or whether they're frontline colleagues delivering. So at the end of this, I'm sure we'll continue to adapt and learn and reflect, but the quality of our people has been the bedrock of any success we've enjoyed. And I think that reflection from the public that we've essentially got this right is their legacy and contribution.
Thank you very much indeed for that, Matt. Fascinating insight into the impact it's had upon your force and indeed the public and partners. And I think that came through very, very strongly. Matt, I'm sure you'd agree with me when I say that if you're organisation felt like it was stress tested. There can't be any other organisation that's been pushed harder than the NHS. And therefore, Jude, it's fantastic to have you joining today's podcast to give your reflections on how your organisation, I appreciate you're from the college as opposed to directly NHS, but I'm sure you have insights from colleagues across the medical profession.
A lot of what you said, Matt, absolutely echoes with our experience. I think we cannot underestimate the extraordinary demands that have been placed on all of our lives and on our services, and the huge human cost in health and care. We've lost hundreds of colleagues who have died because of COVID, and that brings with it the challenges of, fear and anxiety amongst those who, continue to go into work. No business continuity plan could ever have prepared us for what we have had to face. Suddenly to go from, an organisation where we had offices across the United Kingdom, huge big call centres, etc., to working from home almost overnight. The challenge of that has been just extraordinary. If you reflect on the sort of leadership and the, leading through this time, the things that have made the most difference, I think, have been about behaviours and about mindsets and about the approaches that people have taken. Nursing has never been more to the fore of people's minds. They've been at the front of the response to the pandemic. They have led innovation and quality of treatment, and those nurses in the intensive care units. But that's a tiny percentage of what the nursing contribution has been to this pandemic. We've had, nurses keeping people safe in their own homes, who can't get to hospital or couldn't or shouldn't have got to hospital, managing people remotely, managing people in clinics in different settings that they never thought they'd have to work in, just to keep services going. So the resilience I think our nursing workforce have shown has just been absolutely extraordinary. Every nurse has had to demonstrate leadership. There's been almost two distinct threads. There's been the sort of leading through the crisis piece, but there's also been managing the response. Often when we are responding to more shorter term crises, we go into that command and control thing. But actually, in these sorts of ongoing situations, that just absolutely doesn't work. It's about giving the decisions to those closest to the impact of those decisions. And that's certainly something that we did from very early on. The top-down just didn't work at all. However, you still need to give leadership. So it was almost, what's our priorities for the next few hours? How are we going to communicate those 3, 4 or 5 priorities? And, there was decisions having to be made all the time about, well, what do we trade off and what do we not do in order to do this, to respond to this crisis today. But we also had, sort of clear means of escalation to whom, to when, and it did mean lots of extra calls and lots of extra meetings, but it was keeping those lines and channels of communication open. But what was important was we knew when to say, actually, we don't know, but we'll find out. And that was something that was really important about building confidence in our organisation, but actually for those 450,000 nurses that we supported. Something that's really important in these times of great uncertainty is compassionate and inclusive leadership. It enables you to be more credible, I think, as a leader. The other really important thing, and Matt, again, I think you touched on this a little bit, people will look to leaders and you're expected perhaps to be the strong one, the resilient one. Whilst I think as leaders, we need to demonstrate empathy towards others, but we also, I think as leaders, need to be open and to receive that empathy from others. We can't continue to work in the pace at which we have been working. There is something about now, what's our future challenges? What are our workforce challenges? And, where are the sort of, opportunities? First thing, overnight, almost everybody suddenly became remote working. Our whole call centre had to work from home, and that has brought individual challenges for people depending on their domestic arrangements. It has been difficult for managers sometimes to let go a bit. In some of the early days, people were getting very paranoid about, who's online and who's not online. And there's, a bit of a culture of presenteeism started to creep in early on. But the reality is people were finding themselves at home with homeschooling, caring responsibilities. And actually their day's work was over the whole day. It was 2 hours here and 3 3 hours there and 2 hours somewhere else. And we all had to get into that trusting relationship that people were doing the work that they were meant to be doing, and not expecting that everybody's going to be online, in your core hours. Before COVID ever hit, there has been a severe shortage of nurses. 40,000 vacancies in nursing in the NHS alone in England. There's probably 15,000 or so vacancies in social care of registered nurses. And the only way we've got through this pandemic is because they switched off so much elective, routine operations, clinics and all of those things. This pandemic has brought this to an absolute head. Also, COVID has really shone the light on inequalities across health and social care. So there's about 20% of the NHS are colleagues from Black and minority ethnic backgrounds. But what we have seen is that 75% of BME colleagues have struggled to get access to the correct PPE, particularly early in the pandemic. That's a real workforce challenge, I think. But we've also seen how fractured our health and care system is. There's an opportunity to really address some of the structural issues that we've been talking about for probably upwards of 30 years in truth. And that gives great opportunity. So if we think about, what are all the things we need to be doing and what are the skill sets that we need to do that? Actually, health and safety has been another really big gap. There's been, so many issues around how do we protect people? How do we shield people, protect people in the front line? There's lots of areas that we need lots more skills than we've perhaps previously had that have already been sort of Cinderella. And I guess the last few things I'm going to talk about is just that whole kind of, workforce capability in a digital world. And technology has been amazing. We probably leapt more in the last 5 months at the college than we did in the previous 5 years in technological terms. And the same is true, outpatient appointments, GP appointments, virtual home visits have just taken off. We've been talking about them for years and they suddenly happened, somewhere between about the 23rd of March and, the 1st of April. They happened so quickly. I think the downside of some of the technologies are the difficulties in reading the dynamics. When you're in conversation with people, that's certainly quite challenging. And I think for people working in this way, we joked earlier on about, we're all now living at work. It's very, we can get Zoom fatigue, Teams, we all know we sit there all day and the next meeting's coming in and the next meeting's coming in. Whereas if you're in a physical space, you always have the 5-minute walk to the next meeting. So whilst it's been fantastic, I think it has created an intensity to our work probably can't sustain in the way we are currently. I think digital technology should not be used, obviously, to kind of justify cutting back numbers of staff. I think it should be used to enhance what we do rather than replace what we do. And, there will always be a place for face-to-face consultations, for example, will never be replaced by a digital consultation, and we mustn't lose sight of that. And there are huge numbers of people, staff and patients and colleagues who, for lots of reasons, are digitally excluded, and we must always remember to keep that in mind. We're making all our preparations to start opening up some of our premises, and however hard we thought closing down was, opening up is actually more challenging in some ways. Getting all of the things right and all of the complexities of meeting the needs of folk, but also maintaining the social distancing and all of the rest of it. The word agile has been used probably as much as unprecedented, but we've all had to become much more agile. But in being agile, I think we know we have to solve problems today one way, but retain an ability to solve them differently tomorrow. There's something about sort of good social leadership across all of our organisations that will help us to, maintain that agility, supported by technology, supported by our systems and processes. But it comes back to almost where I started. None of it happens without the right mindset and interpersonal interaction.
Jude, thank you very much. And I guess what struck me through that was, although clearly the mission for yourselves and policing are very different, there's so many common themes emerging from there. But I'm sure we'll return to some of those. Stefan, as an interested, as fascinated observer from the outside, really welcome your thoughts on what you've just heard and also your take on it from probably other sectors' perspectives as well.
Yes, indeed. That was fascinating. Matt had a nice phrase about Was it doing unusual things the usual way, or was it doing usual things an unusual way? But it's a bit of both. These are new circumstances, new conditions. Everyone's improvising to some extent. Clearly, in the essential public services, like policing, like health, purpose is more or less clear to everybody. That's a great advantage that the public sector has, I suppose, in this setting, that you're dealing with things that we really need, that we must have. The challenge for the private sector is that there are things that we might want to have, that might be nice to have, not necessarily must have. And equally, in the corporate sector, purpose, I think, can often be much less clear for a combination of reasons. So, in a way, the public sector starts from a better place in terms of the challenge. And the leadership, while exposed and tested just as any leadership is, at least there is an underlying ethos, we hope, if you're starting from the right place, an underlying shared understanding of what the job's really about, what the tasks are, what you're all there for. That perhaps, it tells us one of the reasons why we've been so impressed, as Matt was explaining, the public in South Wales have been impressed, and while clearly the streets full of clapping people have been impressed about what our essential public services have been doing for us. I must say that fantastic strike rate from your call centres, Matt, from the public, does contrast greatly with what we're hearing about some private sector, some customer service, customer care, as it's called, experiences with things inevitably going wrong. And so your percentage hit rate of satisfaction is extremely impressive. But clearly leaders are tested at this moment. They're visible. You've got the whole social media context to deal with as well, which is new. And so I suppose, in the words of the old joke, you want to be starting from the right place. You want to have an organisation that already has that sort of shared understanding about what we're about. You need professionals, you need well-trained people who, yes, know what they're doing and take pride in what they're doing, because you'll be found out very quickly where the gaps are. Or as Warren Buffett, the investor, says about the financial community, when the tide goes out, you find out who's been swimming naked. And I think this moment will have exposed what's good and what needs more work. But I was very struck by, yes, the commonalities in what we heard about the human factor, compassionate leadership, as well as, of course, pragmatic leadership, because we've all had to adapt, we've all had to cope with these strange circumstances while getting the work done. Because in the end, that's what management is about. It's about completing tasks, meeting needs, and so on. So I was very impressed by what we've just been hearing, David.
Thanks very much indeed for that, Stefan. What I'd like to move on to from Matt and Jude now is just your sense of what are you going to do about the future challenges that emerge. And I'm not talking just about COVID. We've all become, I guess, part-time epidemiologists and probably avidly read about whether we've got a second wave coming or it's just an extended first wave. But I think we all now expect this is going to be months, if not years, that we face a new normality. So how are you trying to seek to adapt your organisations to make your response more sustainable? Because you've both alluded to the fact you can't continue to run your organisations in the way that you did so in the first few weeks. So perhaps if I could maybe come to you first, Jude, just reflect on how you're starting to reshape.
Yeah. I think the first thing to say is that first wave, or whatever it was, we did huge amounts of work that even if we get into a second or a third wave or whatever, that work will stand and doesn't need to be done again, if that makes sense. So all of that guidance, for example, for our frontline workers, all of those sort of best practice, etc., we have done. Now, we will need to continue to adapt that as things change, etc. But that level of intensity certainly won't reoccur, I suppose, in that way. I think, looking forward to the future, and it feels like literally it's only in the last week or two that we're beginning to come out of the tunnel, like the little moles blinking into the light, because it has been so, incredibly busy. We are thinking about how do we work with our members going forward, what does that look like, in an increasingly digital world. So, our support to them is becoming more and more virtual and more online. But I think we're looking at, what are the gaps that have come up for us? And I mentioned just one of them, and one of the big ones, actually, there's a huge gap around health and safety, which sounds odd, but there is a big gap around health and safety across health and social care. And some of the basic understandings around good health and safety practices, I think, were brought into sharp relief by this. So it's certainly something that we will be spending some time investing in. We're also, I think, we have been trying to work with government and I had some small wins in the last couple of years around some of the big workforce issues. And so we're having to really, in many ways, ramp up what we do around doing that lobbying and pressure onto governments around really sorting this out in terms of the nursing workforce. And so we're having to ask, well, if those are our priorities, getting the workforce right, getting the pay structures right, getting their pensions right. So we're now saying, well, what will we not be doing? Because you can't just keep layering and layering kind of work on top of that. So, and we do that by making sure we have the best evidence base, we have the best research to back up our arguments, and that's, been working. We've worked really closely with members, and all of that stuff and all of those thousands of calls they've been putting through to us is shaping all of that debate and that conversation. So that's a bit, I think, our external stuff. This is our real opportunity to bear down hard, I guess, on getting these workforce challenges properly sorted out. And then there is the business of how we run our own business going forward. Are we going to be, working virtually? How long will we be? What premises do we need? And all of those kind of obvious things. And those are the questions that are now we're really starting to deal with, and, opening up our premises from next week as well to start to address some of that. But as I say, I think we're still coming out of the tunnel, like the moles blinking into the light. And we're literally going into that cycle now about, right, okay, what's the future look like and how do we get there?
Thanks, Jude and Matt.
So I'm definitely all of the opportunities being wrestled with by corporations and organisations around remote working and communication. All of those things are going to be part of our future in a way which has been hugely accelerated. I think and so I wouldn't add to anything Jude said in that regard. I think there are a couple of areas that sort of resonate for me as we're going forward into the second half of this year and beyond. You mentioned everyone being armchair epidemiologists. Actually, I think one of the positive things that's come out of this last period is a real emphasis on data and evidence and science, and a real emphasis on understanding the lessons from that and the insights nationally and internationally from the information we can draw down. And I really hope that one of the things that will help us sustain and focus and make better decisions is a recommitment to the quality of evidence-based practice. Now, we've had to do that in a very rapid way, and I think we should not assume that evidence-based practice is always about a 4-year longitudinal study, but actually we can act and learn and react quickly. And I think one of the things that evidence, so I think that's definitely something we would want to sustain, because I think that helps us with purpose. It helps us really lock down on the things that make the biggest difference to delivering our mission. I think one of the things which has come out of that evidence is amplified by Jude's comments about inequality, not just in the workforce, but in our communities. I mean, we've seen the enormous evidence of health inequalities, and we see disproportionality and other inequalities and deprivation across a whole range of measures, including, of course, policing, where we see disproportionate outcomes and impacts in some regards, in many regards, over a long period. for particularly our Black, Asian and minority ethnic communities. So I don't think we should look at the next period we're not post-pandemic, are we? We're still very much in the midst of it, but we shouldn't neglect two things that have been of great importance to us in the last period. One is the sustainability agenda and the environmental agenda, which clearly we are all understanding more about how to make an impact there. But the other, I think, critically, is this question about the inclusion of all our communities and all our workforce in what we do. And I was looking at, I think it's a reflection on the Hurricane Katrina experience, but I was looking at some of the reflections from the US, and I think some progressive thought there is, all of these crises should be a test of our civic responsibilities and our civic duties, our ability to respond in ways which are equitable and fair and promote fairness. And, we know here we've looked very closely at the question about that kind of disproportionality or otherwise, and actually it's young people who've been particularly affected by the way that we have approached our enforcement. And of course, tragically, at the other end of the demographic, it's older people who've been very impacted by the health outcomes and by the tragic loss of life. So David, when we were talking about this podcast before, I said it's unusually it's a good period to be middle-aged. Strangely, I really feel for young people emerging into a very uncertain economic time, and I feel terribly for the isolated and potentially unwell, older people in our communities, as well as people who are experiencing all sorts of other challenge. So, for me, going forward, I think sustainably we really have to understand and close those gaps. Close that inequality, whether it's in the workforce, and not apologise for that. I think if we look at, we of course need to get the best outcomes for as many people as possible, but fundamentally we need better outcomes for the people who experience most disadvantage in our communities, and we need to do that with courage and conviction, and explain and articulate that to the whole workforce, explain and articulate that to the whole community. But this is a period to think about closing those gaps and being optimistic and aspiring, which I guess is not what we were doing in March and April. We were surviving to some extent and tragically recognizing that we also had awful consequences. But I think it is a time when we can think about the way we've been connected as communities and as families, and the way we can understand how we can, without being grand, how we can actually shape the future, because we've shown the enormous capacity, particularly of public services. But I also think actually the private sector, as challenged as it's been, and academia and research and just the incredible human capacity that people have got has also been on show. So I would hope we'll be using that to close gaps.
Thanks very much, Matt. Stefan, could I come to you on a slightly different take on that same question? I was really fascinated by your sense that in these times the mission for the public services is pretty clear, and it's more complex for the private sector because sometimes it's them having to set out how they provide things that we like to have. But I'm sure there are some really world-class sectors or organisations that have started to map out how they address those challenges. And are you seeing anything emerge from what you're picking up that might provide some pointers to the public sector to enhance some of the thoughts we've already heard from Matt and Jude?
I think these comparisons are quite tricky because, as I say, the fundamental purpose of the commercial organisation is rather different. Having said that, the strong players have come to the fore, clearly. An organisation like Amazon, for example, is pretty remarkable, whatever you think of it in terms of sustainability and other things. But it's pretty remarkable what they've deployed, what they've been able to do in terms of the capacity they've had and the speed and efficiency which they've operated. So they've built on that strength. So the testing circumstances have sort of rather revealed their qualities, but that's not necessarily a model for public sector organisations. I mean, just to come back to Matt's point about evidence and data, I mean, I think that is at the heart of it. I think that is a really interesting discussion. And as a journalist, I should put my hand up and say, not always completely flawless. We hope that we get one version of the truth, perhaps from the BBC and from some newspapers. Not everyone is in the same game, and clearly when we get into the social media that I referred to earlier, you might not get any version of the truth at all there. So this is the complicated context, I think, for operations, for leadership, for teams, for communication, for the deployment of capable people. That is common to public and private sectors. And playing to your strengths, doing even better what you're already good at. I mean, I think that's what we've seen probably in some private sector businesses, and those who have struggled, the reverse. They've been perhaps a little bit found out where communication wasn't good, where there wasn't the shared purpose, shared understanding of what the work involves. Well, we as customers, as well as citizens, have felt that. We've experienced that firsthand.
Yeah, thank you. Stefan, you wrote a very interesting piece recently. I think it was about the Law Society, reflecting on some feedback that they'd internally shared, that things seem to be working well. And you quite rightly pointed out that actually they should be also asking their clients what it felt like. So, Matt, notwithstanding the very low level of complaints you'd received about response, how are you going to find out what the public expectations of your service are going to be over the next few months?
Well, I think the first thing to say is, of course, we've got our own internal measures of that, and complaints as an example of that kind of metric. But we're not really for us to mark our own homework in this respect. So we've been working closely with partners, and we've got a long-standing relationship with our public health colleagues here, and they do phenomenal research, which has supported our decision making over the last 3 or 4 years. What we've seen from the most recent research in relation to confidence in us using our powers responsibly during this period is relatively high levels of public confidence, sort of in the region of about 4 out of 5 members of the public having confidence. So I think that's a first, and there is data out there from others, and we should continue to seek out the information from third parties in that structured way. What's been really important to us is a fundamental investment in hearing from communities directly. So our neighbourhood policing model has been very important to us during this period, and in particular, as I've described, not exclusively, but certainly our diverse communities, our Black, Asian, minority ethnic communities, we've been very concerned to engage. And of course, that would have in the past. We're recording, as Eid is with us. That would have been by visiting venues, being with communities in that way. So we've had to structure a whole set of community engagement in ways which is remote, digital, dispersed. And actually, we've probably seen some of the best attendance and participation through those mechanisms that we've ever seen. So rather than, and we probably all an experience in policing of, community settings rammed, to the rafters with people who want to speak, but we've also been to the drafty village hall with, a handful of people, and in fact, we've seen really high levels of democratic engagement, great regular engagement from members of Parliament and members of the Welsh Parliament for us here. So I think that online forums and online mechanisms actually, although they've been a response to our social distancing, I think they represent a real opportunity for us in the future. So structured engagement, definitely those online forums, certainly still an investment in democratic structures, because I think those have been important. Important to hear how our people are experiencing this period as well, and we've run and will rerun again staff surveys during this period, because of course we are we live and work in the same communities to a large extent. So our own people are a very good reflection of their community's experience as well. The area, and Stefan's touched on it a couple of times, the area I'm less confident that I understand what it tells us is social media. Less confident in how much we should use it as a barometer. But it's irresistible in many respects that we've got to respond and pay attention to it. But it's been a real Goldilocks period for us in terms of social media. So sometimes we seem to be doing too much of something, sometimes we need to be doing too little. And of course, you're trying to get it just right all the time. And so, really well-intentioned community support officers will patrol a local beach during the heights of the lockdown to point out to people that we were present and responding to their concerns. But their picture posted on social media gets a reaction from a number of people to say, it's great for you being out there during this lockdown, having a walk on the beach. We're not. And so there's been obviously a very heightened sensitivity, and there's no criticism in that. I think there's no right or wrong in this. It's that Goldilocks test of trying to understand how to give out messages which feel humane and human, feel compassionate, but also feel authoritative, and also understand that there is then in the whole mix, the normal range of, sometimes less structured and less helpful engagement you can get through social media, as well as some really high quality engagement we've had with communities. So I think we're still working through. I think the one thing we have found, we've definitely changed the tone during this period of our social media, and personally I have as well, because I think the public broadly wanted to know we were serious, committed, prepared, planned, and responding. And so, I think it's been a real time to be earnest, to avoid anything that appeared, could be construed as frivolous. But at the same time, every time we've posted a story of community support officers delivering food parcels or reaching out, that has had immense resonance with our communities. So we should never lose the humanity of what we're communicating there. Going forward, how will we know? I mean, I think we win and re-win our legitimacy every day, and I do think that we've all had concerns about community cohesion during this last period. So I definitely know that we will be paying really close attention to that over the rest of 2020, and I'm sure beyond.
Thanks, Matt. And I found your thoughts on social media really fascinating, because that's such a massive challenge and can become time-consuming or consuming itself. Probably the last question from me, and I'll start with you first if I could, Jude. Jude, if you were to look, say, 3 years in advance from where we are now, how would you want your organisation to look and feel differently as a result of what we're currently going through? So this is not necessarily wish fulfillment, but as a senior leader in the organisation, how would you like to see it would have changed?
Well, I think what I might answer first is probably more generically around kind of health and social care, because, we are partners with our colleagues in health and social care. And I think, I have worked on the front line for many years. I'm, relatively new in the last couple of years into the college. And I think what all nurses would like to see in 3 years' time is a much more joined up, cohesive, seamless service, for patients that, without artificial distinctions between what is social care and what is primary care and, what is hospital care. Because all of that just makes for quite a fractured experience, I think, for patients. And so what I would really, in 3 years' time, is to see a sort of single 4-country, because actually it's different in each of the 4 countries of the UK as well, which brings its own challenges, is a truly seamless health and care service, or health, or health and social care, whichever you want to call it. But that it is one. It is not health in one corner and care and social care, I think, in another. I don't think there's a nurse or indeed a medic or paramedic or allied health professional who would argue with that. So if we can get there, and of course then there's the, all of the stuff with that means that that organisation that, should be an inclusive organisation. I touched on it earlier. I know Matt has touched on it as well. But there are huge inequities in our health and social care service, both for the staff and for the users of that health and social care service. We know that if you're black, from certain groups, your health will just be worse. You are more likely to live in poverty, which creates its own, health inequalities, etc. So a health and care service that is seamless and that is absolutely inclusive for both those who use it and those who work in it, because it is hugely inequitable, I think, at the moment. And as a college, I guess, we need to be able to respond to that with all the professional demands that will bring, because that will mean, people will have to work more agilely in different ways, and that we continue to give the sound professional advice to enable nurses to do that. but also, I can't not point out that, there has to be, decent pay and decent workforce plans, and that will be our job to fight for some of that, to fund that nirvana that we will get to, hopefully, over the next couple of years.
Thank you. And Matt, reflections, and I'll come back to you finally, Stefan.
I mean, I think that the one thing for me to say is, I work with some of the most deprived communities in the UK, and some communities that have been under enormous pressure, certainly since the 1980s. So I would like to look forward 3 years and feel that we are playing our part in sustaining and nurturing those communities through what is inevitably going to be a very difficult period for society and for the economy. So I would like us to be an important part of that journey. I would like us to still be a trusted part of that journey, and nothing that we've done in this period to have undermined the trust and confidence of our communities. I would like us to continue to recognise and respond to the need for our own diversity, and make more progress on that in many of the ways Jude has described for the workforce, but also to have made some real progress on the issues around community confidence and trust that have been brought back into focus, not just by COVID, but of course by Black Lives Matters and real attention to disproportionate outcomes and discrimination. I certainly, would I want us to be doing more online meetings and all of those things we talked about, have a smaller estate? I think all of those things are part of it, but I would like us to be doing that in a way which felt efficient and fruitful. And I think at the moment we're in the midst of it, not really quite understanding how to do either to the best effect. And we're just doing a lot of it. So I'd like us to be using technology swiftly and efficiently. I think, to go back to the other point I made earlier, I really do think there's something about our understanding of evidence. I think if we can, as a set of, not just from a policing perspective, but a set of organisations, be as willing to share data and willing to share our insight and shape our policy intentions together at pace, and put the organisation's concerns behind the central concern of our communities. I think we should be even better partners in the forward, not just in the future, not just a better organisation.
Stefan, I'll just come back to you for the final question. Stefan, if you were being brought in by South Wales Police or the Royal College of Nursing as a consultant, and they were saying, how do we best prepare for the next couple of years, what would you be saying to them now as a interested but objective observer?
For a minute, I thought you said I was going to be brought in by the police, full stop, which we can't rule out at one point. But I think, I think we've heard it. It's managing the trade-offs, isn't it? And that applies to both the public and the private sectors, actually. We have learnt a lot about new technology, about flexibility. It's been an accelerator, and largely in a good way. And we've learnt some good things. But equally, we've got to remember the human factor and what was actually working fine about the old normal. So I think it's a balancing act, blending the good things we've learnt, preserving, retaining, enhancing the good things we had in the past. It's not either or. It's that classic leadership challenge of managing the trade-off, managing even paradoxical trade-offs about what's good and what's bad, what we've learnt, and somehow blending that into the future, all in the context of this difficult moment in our lives. So it's not easy, and that's why leadership is so difficult.
Thank you very much indeed. I just want to conclude the podcast with a few thank yous. First of all, of course, to Jude, Matt and Stefan for giving your time in your very busy schedules. I was fascinated just being part of it, and I hope that the listeners have found it too. Can I thank everybody who's listening to this podcast for joining us? That's what makes it worthwhile. And can I also give a very special thanks on behalf of Cityforum to BT and Cisco, who are our industry partners. Quite simply, without your support, these events would not happen. So we are very grateful that you make them possible and gives us the opportunity to share the learning from 3 first-class operatives in their disciplines. That's it from us. It just leaves me now to hand over to Christine Elliott, the interim chair of the College of Policing, who's going to provide her reflections on conclusions from today's discussion. Thank you very much.
It's a tall order to follow three such distinguished speakers, so I'll start by saying that I also chair the Health and Care Professions Council, which regulates 15 professions, including physiotherapists, paramedics and clinical scientists, so it has been a busy COVID. However, the policing leaders I know would be the first to say that this pandemic's been predominantly a crisis that's impacted on healthcare, though it's obviously had challenges, big ones for policing too. In some ways, the world's never seemed further apart, and yet the strength and cohesiveness of communities has served us all during this pandemic. Sadly, I know that gratitude is starting to ebb, and reactions to incidents attended by the same key workers we applauded on our doorsteps, both in real life and online and in the media, are less sympathetic, more adversarial and less respectful. So I think that the policing approach of engage, explain, encourage and only enforce as a last resort has been absolutely right, and by and large, with a few blips, it's worked. The preciousness of the model of policing has been tested as never before, and at the intersection of the events surrounding the tragic death of George Floyd. Our response to this must be current, decisive and effective. And so at the college, we have made diversity, digital and leadership for all levels our top 3 priorities. What we're now looking at doing is what I would call winning the peace. What will that involve? Well, let me just think back to some of the key themes from our speakers. The legacy of operating at pace clearly is something which has been a big gain. We've done things in policing that people never thought themselves would be possible, in particular the move online. And there have been efficiency gains, which I think will serve us well, given the pressure on the public purse. Ditching redundant processes is, of course, part of that, and we must be sure not to go back to this is how we always used to do it. Science, be it data or other forms, and the absolute importance of evidence-based work and sharing best practice have become paramount, and so they should be, so I hope that we'll keep that. We certainly plan to. For policing, using the opportunity of the 20,000 new police officers uplift to model a representative workforce and behaviours in leadership on a large scale is something that we really mustn't lose. Nor the ability to corral quickly multi-agency responses, and we have seen the effectiveness of public health-based approaches, collaboration and real partnership, relationship building. Maintaining shared purpose has to be at the forefront of all of this. And last, but definitely not to be forgotten, well-being must remain as central to supporting all of the workforce. And we've certainly learned a lot about the increased challenges, particularly to mental health. So the police service, Oscar Kilo, has been working at full belt, and I expect that post the crisis there will be a lot more work to do. Not that we're there yet. Last, I guess, in summary, I would trade every clap on the doorstep for people to continue to value those in the key professions and listen to their advice more carefully. And in return, those dedicated key workers will be better motivated, equipped and ready to do their challenging work for us and for our communities.